Discussing about PSM questions in CBT paper 2. Which of the following is not included in Global Hunger Index? Global Hunger Index, malnutrition in under 5 population. There is malnutrition in overall population and mortality in under 5. But infant mortality rate is not included, right? So option A is the correct answer here. A sedentary woman requires 1600 kilocalories. Lactating women requires 600 extra. So a sedentary lactating woman requires 2200 kilocalories. Given image shown is related to. So this is Sapna. Sapna is a mascot and she is related to leprosy. There is another mascot, Meena. Meena is UNICEF mascot. She is UNICEF mascot for leprosy. Sapna is NLEP mascot. M cessation is related to tobacco. It is related to tobacco cessation. Mean, median and mode 120, 160, 180 respectively. So when positive skew is there, mean is more than median is more than mode. In negative skew, mean is less than median is less than mode. So here the correct answer is option B. Here the correct answer is option B. If I talk about normal distribution, here mean is equal to median is equal to mode. High virulence means more death. If there are more deaths, it will decrease prevalence. And there will be incidence will be same. So here the correct answer is option B. When more deaths are there, or you can say another scenario where the disease is very much treatable, right? In both the cases, there will be less number of cases in the community, and that is why less prevalence. Dash is used to measure killing power. It is the case fatality rate which is used to measure killing power. Proportional mortality rate tells us about burden of disease. Correlation coefficient is plus 1.2. This implies, so when there is correlation coefficient more than plus 1 or less than minus 1, in both the cases it is a mistake or wrong statement. Correlation coefficient, positive correlation coefficient means R more than 0 but less than plus 1, less than or equal to plus 1. Negative correlation, R is less than 0 but it is more than or equal to minus 1, right? More than minus 1. More than minus 1 is minus 0.9. Less than minus 1 is minus 1.2, right? And when R is equal to 0, we say no correlation. Here, if R is more than plus 1 or R is less than minus 1, right? So here the correct answer is option D. Statistical power of a test is Statistical power of a test is when we do not accept null hypothesis when it is false. Accepting null hypothesis when it is true is confidence. Not accepting null hypothesis when it is true is type 1 error. Accepting null hypothesis when it is false is type 2 error, and this is power. And this is power. In other words, this is alpha. In other words, this is alpha. In other words, type 1 error is alpha. And confidence is 1 minus alpha. In other words, type 2 error is beta. And power is 1 minus beta. Best method to show time trend is line diagram. It is line diagram. Appropriate test to measure height among two groups. So height here, height is mean. It is quantitative data. If we have to compare among one group, it is pair t-test. If two groups, it is unpaired t-test. If more than two, ANOVA. Here the correct answer is B, unpaired t-test. Instead of each data point contributing equally to final mean, some data points contribute more than others. This is weighted mean. This is weighted mean. Learning by doing. So when we learn by practicing ourselves, for example, we are driving car and we are using our hand. We are doing a surgery and we are using our hand. When we perform, this is, here we are using skills, and this is psychomotor. When we learn, when I am learning the procedure of surgery just by reading the book, this is cognitive. And we learn with, when we learn with emotions, when I learn something with emotions, emotion can be happy, sad, angry, scolding, something like that. This is affective. This is affective. Right. Who is responsible for vaccination at Anganwadi center? At Anganwadi center, we have Anganwadi workers. And I have one Anganwadi helper. 2 staff is there at Anganwadi. But they do not do the vaccination. They only maintain the register. Vaccination is done by ANM. Vaccination is done by ANM. For rural area, 1 ASHA is for 1000 population. 1 ASHA is for 1000 population. So option C is the correct answer. Not true about sandfly. Sandfly, it has a hairy body. This is true. It has long legs. This is true. It does painful bite. This is also true. It causes yellow fever. Absolutely no. Because yellow fever is caused by Aedes mosquito. It is caused by Aedes mosquito. Vector responsible for scrub typhus. It is trombiculid mite. It is the trombiculid mite which causes scrub typhus. Not true about Factories Act. 1 safety officer for 1000 worker. That is true. 1 welfare officer for 500 worker. That is also true. Less than 14-year employment is prohibited. That is also true. 1 crèche is for 80 workers. No, it is for 30 female workers according to Factories Act. According to Factories Act. Disease caused by cotton fibers. disease caused by cotton fibers is bicynosis. It is bicynosis. Sugarcane dust or sugarcane fibers, bagasosis. Right? So option B is the correct answer here. Most common indirect cause of maternal mortality. PPH is the most common direct cause. Anemia is most common indirect cause. Right? So here the correct answer is option C. Not true about reference Indian man. Reference Indian man, weight is 65 kg. True. Height is 1.73. That is also true. Actually, it is 1.73 meter. 1.73 meter. Age 18 to 39. No, it is 19 to 39. And BMI is 20.75. That is also true. Right? So here the correct answer is option C. Toxin responsible for epidemic dropsy. Epidemic dropsy happens when mustard oil is mixed with argemone oil. And in the argemone oil, there is one toxin known as sanguinarine. There is one toxin which is known as sanguinarine. The clinical features are edema, pedal edema, glaucoma, pedal edema, glaucoma. Paradoxical carrier. So who is a carrier? Carrier is the one who carries the disease but there is no sign and symptom. This carrier can transfer the disease to any other human being but himself or herself, that person is not having any sign and symptom. If a person is a carrier, and he also got the infection from a carrier, right? In this case, so carrier from a carrier is paradoxical carrier. Option C is correct. Cyclodevelopment is when there is only development. When there is only development. Only multiplication is propagative. And both, when development and multiplication both, it is cyclopropagative. Which of the following is not a non-randomized study design? Pre-post study, uncontrolled trial, and natural experiment are example of non-randomized study designs. Whereas RCT is a randomized study design. It is a randomized study design. Simplest measure of burden of disease is proportional mortality rate. Case fatality rate is for killing power of disease. In other words, you can also write virulence of organism. Right? So, case fatality rate, either killing power or virulence. Simplest measure of burden of disease among all the given option is proportional mortality rate. Incinerated waste to be disposed in yellow bag. So yellow bag, we dispose all the incinerated waste. Now Nishchay. Nishchay is a pregnancy kit. Nishchay is a pregnancy kit. Nikshay is TB online portal. Nikusht is related to leprosy and M-cessation is related to tobacco. Right? Program for labor room quality, Lakshya. Lakshya is the program for labor room quality. First dose of which vaccine can be given after 1 year? BCG? No. Rotavirus? No. IPV? No. MR can be given up to 5 years. It can be given up to 5 years. Right? So these were the questions in your CBT exam. Thank you very much. If you have still any doubt, you can ask me anytime.